So today we are going to see about observation. Now observation, the English meaning is just looking, okay, looking at something. Okay, so if you look at a patient and observe their behavior, you can come to a conclusion about the way a person behaves. See, a leprosy patient behaves differently, a student behaves differently, a cardiac patient behaves differently, a coronavirus patient behaves differently, a school student behaves differently, a college student behaves differently, a teacher behaves differently. So each of their behavior you can observe. Similarly, there are other factors that are involved, like in certain situations, in a fearful situation people behave differently, in a happy situation people behave differently. Okay, the same person may behave differently in a fearful situation, same person may behave differently in a happy situation. So these can be observed. So usually the behavior of a person is observed. So observation is one of the common ways in which we collect primary data. You understand what primary data is? When a researcher collects the data secondary directly from the subjects. Okay, so observation is purposeful, systematic, and it can be done by watching and listening to an interaction. For example, in if you have heard about selection process for MBA or Master of Business Administration, there is something called as group discussion. So the students who are applying for a particular course, they discuss as a group, so that the college will have an observer who will observe how each of the people is behaving, who is being very loud, who is being very quiet and not talking at all, who is assertive, who has leadership qualities. So they observe and find out about the person, okay, during an interaction. So this is what observation is all about. So observation is a very good method of data collection, especially in a particular study population. See, if you have another example I can give is, when you have a group of leprosy patients who are doing self-care for their hands or feet, then you can observe them. What are their discussions, what are their problems they face, how they conclude, or how they find solutions for their problems. That can be a observation for a research study. Similarly, when you give health education for diabetic patients, you can observe the patients and see how they behave, whether they find it easy to follow the advice that you have given, whether there is any benefit of the health education that is given. So all this can be observed. Okay, usually the behavior and the personality traits of a person is observed, and that can be used as data for your research. There are actually two types of observation. One is the participant observation and the other is the non-participant observation. So what is a participant observation? So as a participant observer, as a researcher, you are part of the group. Okay, the group does not know that you are the researcher. They think that it is a common group, and they go about doing their work, and you observe the members of the group. Okay, this is what happens, as I said, in the MBA admissions group discussions. One of the people in the group is a observer. Okay, so they observe about other people and then they collect the data and then they report it. Okay, so the one example that I have given here is, if you want to uh, find out the reaction of general population to people in wheelchairs, you are part of the general population, and then you can observe each person's reaction when somebody in a wheelchair is going. Or the other way of doing it is, you can be in the wheelchair and then you can look at each person's expression and document it as data collection method to see how other people react to you going in the wheelchair. So that is one method of participant observation, where you as a researcher is present in the location and nobody knows that you are doing a research, and you observe the participants and collect the data. On the other hand, non-participant observation means the researcher, that is, if you are a researcher, you are not involved in the activities of the group, but you are away from the place and you are watching it through a video recording, or you can sit in a place where where the participants in the research cannot see you. Okay, for example, if you have seen in the movies, you can see that there are invisible screens where other side the police and the criminal are having a interrogation where other people can watch from the outside. So that kind of observation is non-participant observation, where you as a researcher can observe what is happening, but the other people do not know that you are observing them. This can be easily explained also, like if you are working in a hospital, or if you are observing the activities or behavior of a patient, you can sit in one corner of the ward, okay, and then observe the behavior of patients. Similarly, if you are a faculty, you want to observe the teachers who are teaching in a college, then you can just observe the teaching from a remote area or somewhere where the others do not know that you are observing them. Similarly, the functioning of nurses in a hospital, the doctors in a hospital, or any other professions, you can actually observe their work and the behavior of each of the workers by not participating in the overall scenario. You can be aloof in a different place or location, and you can follow the activities going on. So this is non-participant observation. Okay, you are not part of the group itself, you are away from the group. There are some limitations or problems when you use observation as a method of data collection. Okay, some of the common problems is that when people who are part of the study, they understand that you are observing them, then they change their behavior. Okay, they do not behave normally. For example, we saw one example where we told that the reaction of people to somebody in a wheelchair. Okay, so when you are in a wheelchair and you are observing the reaction of other people, what will happen is they look at you, and when they see you looking at them, they will immediately turn the other side. That means they don't want to show you their real reaction because you are observing them. Okay, I hope you understand this concept because it's quite important. So the problem with observation is when people notice that they are being observed, they change their behavior. They put out the best behavior. Sometimes they put out the worst behavior also. So usually it's the other way. They show themselves having positive behavior. Okay, so what will happen is the real reason for which you are doing the study, you do not get the answer because there is bias. The people who you are observing, they do not react normally, they do not behave normally, they behave in a abnormal way, that is in a way that they think it is right. Okay, for example, when somebody sees a patient on a wheelchair, usually they feel pity. A normal population will feel pity for the person who is on a wheelchair. Okay, but when people are being observed, they show as if they are ignoring the person. They want to show that they are ignoring and not feeling pity for the person. Okay, when nobody is watching them, they will be looking at a person in a wheelchair and they'll feel pity or sadness. So when somebody is observing, they will put out the different behavior. So this is called the Hawthorne effect. Okay, Hawthorne effect is when individuals or groups become aware that they are being observed, they change their behavior. Okay, so finally what is observed may not be their normal behavior. So this is called as observer bias. I was telling about bias. So the data that you collect through observation can have observer bias, which is the Hawthorne effect. So what will happen is your study will give a wrong answer or wrong interpretation. Okay, so this is one of the main reasons why observation as a method is not used for data collection at all times. See, another example is if you are looking at the functioning of a nurse or a doctor and seeing if they are behaving well with the patients, Okay, as soon as the nurse or doctor know that you are doing a research study on their behavior with patients, they will behave very well with the patient. They will be very kind, they'll be smiling all the time, and they will interact with the patient. So in your research, what will your conclusion be? You will say that all the nurses and doctors are very kind to the patient and are very considerate. But actually, when you are not there, when nobody is observing, maybe some of them will be angry with the patient, they'll talk rudely to the patients. So Hawthorne effect creates observer bias, which changes the behavior of the subject who you are observing. Okay, so that is the reason why observation cannot be used at all times. Okay, but at the same time, we can use observation as a data collection tool in certain areas. So we can use it under two conditions. One is the natural condition, the other is the controlled condition. So natural condition is in the when nobody has created a special situation for the observation, so it is in the natural settings. Okay, so that is the natural observation. But if you create a special situation, you create a self-care group for a patient and then you observe the patients, then it is control conditions. You have created a specific area and place for observation. So this has more likely chance of Hawthorne effect, because people know that there is a research study going on and they can behave differently. Okay, so natural and controlled observations are two situations and two methods in which you can do the observation as a data collection method. Okay, the next thing is interview. Okay, so we'll see what are the types of interview. There are three types of interview: structured interview, semi-structured interview, unstructured interview. Okay, structured interview means just like you make a questionnaire and give it out to the patients, you write down the questions and interview the patient or individual who are the samples. Okay, just remember that I am going on saying patients whenever I talk about research. That is because as sociology students, you most probably will do data collection from patients. That is why I'm telling patients, but it is applicable to any sample. It could be if you do research study on a group of staff or faculty, then they'll be the subjects. Okay, so instead of patients, you will have to be saying subjects. So the structured interview is administered questions, that is already written down questions which are asked to the subjects. Semi-structured interviews are those where part of the interview is structured and some of the questions that you ask may be leading from the answers that are given by the subjects. So that is semi-structured interviews. So you have an agenda, you have a listed questions, but sometimes if you find that some of the additional data can be collected, you can have additional questions and then that will become semi-structured interview. Unstructured interviews are in-depth interviews where you as a researcher have a lot of questions with different kinds of situations and you collect a lot of information. Okay, so how can we collect data regarding using interviews? You can use audio recorder, you can use camcorder, you can use a digital recorder, you can even use your phone for recording the interview. Okay, so interviews can be recorded so that you can play it back and write it down and use it in your data. So let us see what are the types of interviews. First is the unstructured interview. As I told, unstructured interview, there is no structure. You can ask any questions and so unstructured interview, you can formulate the questions and based on the situation you can collect the data. It can be both quantitative or qualitative data. You can find out the answers based on whatever the person is telling. So in unstructured interviews, different kinds of questions can be asked, so you have to record because you do not have a structured questions. It may be that you forget the answers later, so you have to record all the information that is collected in the interview. In the structured interviews, so the next type of interview is the structured interview. So structured interview, what happens is you have a set questions, that is all, it is a written down questions in the same order, and you ask each of your samples or each of your subjects in the same order, so it gives a proper schedule. Okay, and it is easy for you to do data collection because everybody will get the same questions and they will give answers which are your data. Okay, so the information that is given is in similar form, it is in uniform form, so you can compare the data between the answers given by different people. Whereas in an unstructured interview, each person may tell answers in a different way, and you have to collate it and then use that for your results. And the next thing is the in-depth interview. Okay, what is in-depth interview? In-depth interview means you have to go in detail in your questioning. Okay, you will be doing face to face interview. Okay, you will, it's not like a interview through the phone or interview through other methods, but in depth interviews, it is a face to face interview. You are sitting right in front of the person who you are interviewing, and you will do the interview. And the next thing is, and you have to understand the perspective of the person you are interviewing. Okay, so their view, perspective means their way of understanding, their view, that has to be understood by you. So that is why it is called as in-depth interview. So here it takes a lot of time, it builds a relationship between the interviewer and the person who is being interviewed. So the data that is collected will have more value because the person who is answering your questions, they understand you, and there is a good interaction and rapport between two people, and that is why it's called an in-depth interview. Okay, the last type of interview is a focus group interview. So focus group is mainly there are particular areas of interest which is being discussed. Okay, so the broad areas or the topics that are going to be discussed are decided beforehand. So suppose you are going to discuss about domestic violence, you will come up with a few questions which are discussed in a forum, or a few people who have undergone such problems, they come and they discuss. So different questions come up from that and different answers come up from that, and you will be able to collect the data for the questions that you have already written down, and you will also get a lot more information regarding domestic violence. Similarly, if you are doing a research study on self-care for patients, then a group of patients with self-care problems, they discuss what are the problems in self-care, how they can solve these problems, how to overcome disability. So these are some of the common questions that they will discuss, and their answers form the basis for your data for your study. Okay, so there are certain advantages of interviews. What are the advantages? If you are a good interviewer, then the data collected is very valuable because you are involved in the collecting the data. Okay, it is usually better method of collecting data when young children or illiterate people or such people are used for your study. That is because others you can give a questionnaire, these people questionnaires will not give you the correct answer. So this is the advantage of interview for such people. Then it is a very practical method of collecting data, and if there is a friendly atmosphere, then the interviewer and interviewee have good relationship, and that gives you nice data for your research. Okay, and it is also a medium in which there is exchange of information, so you will learn a lot of things from the data that you collect, and the person you are interviewing will also learn a lot from your way you are questioning. And it prevents things like bad handwriting, poor expression, all these things can be avoided by the interviewer. And the next important thing is the personal contact, okay, between the interviewer and the person being interviewed, means that there is a deep probe, that is, you can ask deep questions or important questions based on the behavior of the person, and that will help you to collect relevant data. And generally over many years it has been found that interview method has provided reliable data, and based on the answers that is being given to you, you can also have cross questions for the person who is being interviewed. But in spite of this, there are certain limitations of the interview. This method is very time consuming. It takes a lot of time. Like I said, you can give 1,000 people a questionnaire, printed questionnaire, and all 1,000 of them can write the answers at the same time, and within one day you can have 1,000 data forms if it's a questionnaire form. But if you're doing an interview, each person you have to interview, and it takes a long time. Okay, the other thing is, when you interview, you can have bias. It is not very objective, because it is how you understand the answer that is given by the subject, how you take it. So you can have your own interpretation of the views given by the subject. So there is a chance of interviewer bias. So that is why the objectivity, sensitivity, and the insight of the interviewer is very important. So that will come only with experience. If you are an expert interviewer, then you will be able to understand what context the person is talking and what meaning the person is giving. So that will help you in providing data which is relevant and objective, instead of having interviewer bias. Okay, so many people will, both the researcher as well as the subjects, will prefer a questionnaire because of the time consumption instead of having a long interview. Okay, and there are other limitations. If you are asking questions to somebody, okay, they may not give the right answer, they may not feel like giving the right answer, they may hide things, or they may judge you in a different way and think that you are delving too much into their personal space, and they may not give the right answers. Whereas if it's a written document, they will write what they feel. Okay, so these are some of the limitations as far as the interviewee is concerned. Then the data from the interview can be difficult to interpret and put down on paper. See, if it's a questionnaire form, it is easy for you to compare the data and put it down. Even in a structured interview, it is okay, but in a non-structured interview and a semi-structured interview, it is very difficult for you to actually collect the data and pick out what is relevant for your study. And if you are going to tape record the interview and then play it back and then collect the relevant data, it will take a long time for you to pick out the relevant data. Okay, and if the subject who you are interviewing are very small children, if they are shy, or if they are deaf, or if they are mentally challenged, then you will not be able to collect data through interview method. Okay, so these are the limitations of interviews. So there are positive or advantages of interviews as well as limitations of interviews. You have to understand the different types of interviews, that is structured interview, semi-structured interview, then unstructured interview, focus group discussion, and in-depth interview. So these are the different methods of interview. In the next class, we will be studying about the questionnaire, and after the questionnaire, we will be studying about the checklists. With this, we'll finish this chapter. Okay, see you in the next class.